You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Sean Wilkie, and along with my awesome co host, we interview the innovators in this space every week. Super excited for today's episode. Ivan, why don't you get us started?
Hey, I'm Ivan Zach, and I'm excited to introduce a colleague of mine, Dr. Emily Hubbard. Dr. Emily Hubbard is a Chief Medical Officer at Veterinary Innovative Partners, also known as VIP, just like our podcast, a network of nearly 70 veterinarian owned and operated hospitals across 12 states. With over 12 years' experience in private practice and corporate medicine, she has guided more than 150 veterinarians as a trusted medical leader. Driven by a passion for exceptional care, Dr. Hubbard champions VIP's life first culture to support and empower veterinary teams. Emily, welcome to the show. Thank you for finding the time.
Thank you.
So, why don't you tell us about Veterinary Innovative Partners? What's different? What gets you excited every day? And what is the vision?
Yes, thank you. So, VIP or Veterinary Innovative Partners is really special. It is veterinary owned and operated. So, that is really something very different from what's happening today. It was actually started by two veterinarians. So, their vision, and this is what I strive to uphold, is medical autonomy within every hospital and allowing the best support for the doctors and the teams in the hospitals at the same time. So, a lot of that significant freedom in the framework, but that's what VIP really strives for. And myself, my focus in all of this is how can we continue focusing on our people for a life first approach? And that's what also drives VIP forward.
So, I got a question for you. And the topic today is of the innovation around conflict management. And so, I want to know why you want to talk about that. And then I want you to tell us what you guys are doing that's innovative when it comes to conflict resolution and management.
Yeah, absolutely. So the conflict management is, it seems like intuitive. It seems like something we all should be able to do and do well and handle, but we know in our veterinary space that is very difficult. It is fraught with conflict for multiple different reasons. And so, as part of our culture in VIP, we are being quote unquote innovative with this focus on mental health and well being. And so a lot of what we're doing is almost repurposing foundational skills. So focusing on those soft skills that will help boost confidence, our engagement, productivity within our hospitals. So a little bit of a two steps back, one step forward, but that is how we're starting to build programs. And one of our biggest programs that we're about to launch is a leadership summit. And a lot of these tools and skills will be utilized at that summit where we invite all of our hospital leaders to be able to brainstorm, teach, train, role play, to really provide them necessary skills that they need in these hospitals every day.
That's really cool. That's something that I'm focusing on in our hospitals quite a lot. There's two main things that I think that veterinarians lack as a muscle. One is the feedback provision, basically how to provide and accept feedback. We're absolutely unable to do so. We all want to be nice, and then it grows into silent, and then it grows into passive aggressive, and then it grows into toxicity. The second one is the conflict resolution. We focus on that a lot too. But I recently was reviewing, which is part of our system, the book by Patrick Lencioni, The Five Dysfunctions of the Team. And they talk specifically about conflict there. So do you incorporate anything like that? Because conflict is not all bad. It's not because when people say conflict, everybody thinks people fighting. It's not really that. It's the debate, it's the positive way to manage it. So do you adopt anything from there? And is there a hint in there?
Yeah, absolutely. That's actually a very strong nod to it because conflict is part of our day to day. We know that in our veterinary world, I mean, we have big emotions we deal with every day. We have different skill sets of how to cope throughout our team and our pet parents. So, what we do with our conflict management in a healthy way is really teach our teams how to communicate. Because if you really get down to the heart of everything that we do, it's proper communication. And healthy conflict can push us to great ideas, it can push us to new growth opportunities, and it is very good. But I think you're spot on in the fact that feedback is not a normal part of our culture, if you will. And so if we don't have open lines of communication, then how are we able to solve anything?
Yeah, it's so fascinating. And I've just recently reread The Five Dysfunctions of a Team, which I think I would recommend to anybody that's leading people out there in the wild. And this idea, and Ivan, I'm going to give you a compliment. I hate doing it, but whenever I do something to offend Ivan, he texts me right away and he tells me, and it's like, I knew that was coming. And he does it very clearly, and then we have a conversation, and like we're after 10 years, like building a friendship now, and it's probably one of the reasons why, because I take the feedback, I usually apologize, or sometimes we have more conflict. But I think that's really, people don't realize the value in just getting it out of their system. I mean, they stew on these ideas, and they stew on the fact that you didn't say the thing, or you had more to say, but you didn't say it because you didn't want to offend anybody. And then all of a sudden, everything falls apart. You can't lead and you don't get those magic moments. The question that I have for you after that little soapbox talk there, and that unintended compliment for you, Ivan, is, Dr. Emily, have you seen any magic happen as you're going and teaching these skills, whether it's conflict resolution or, healthy conflict? And can you give us some examples of what the magic is?
Yeah, absolutely. So the magic has been, I don't know, such a treasure, actually. It's very rewarding to be able to teach these skills, even in just conversations. So this can just be very simple travels in my hospitals, chatting with different hospital leaders. But it has been wonderful because, like I said, a lot of these skills are very soft. Sometimes you don't really think that, like, oh, we have to talk about this or we have to review it or let's actually say the things that we're trying to do. So small things have been very, very helpful. So an example of a win that I had recently is I actually had traveled, this was months ago, but traveled in multiple hospitals with this one leader. And, we just had a great heart to heart. And we went through just some very basic steps of, well, we talk about triangulation. And I think that's what you guys were talking about earlier. It's like, why don't we just have these conversations just outright with the parties? And so we were talking about how to not triangulate and not to solve for other people's problems, how to bring the leaders or the doctors or whoever it was together. And it was great. And I was like, wow, you're listening, all this. Well, just a couple days ago, I was on a phone call and with this same leader, and I was listening to her coach her team. And she brought up exactly what we talked about and started utilizing those skills. And she was able to stop a triangulation and say, hey, let's just get these two people together and let's just talk about it. And I'll be a mediator or I'll help you walk through it. And I just had such a big smile on my face because I was like, oh my gosh, like this is helping her. And now she's able to pay it forward with her team. So that was a great, great one. Now I have plenty of examples of my own mistakes that I made and my learnings, which is a lot of the material that I teach throughout the years.
You too?
Yeah. No,
No way.
never, never.
Mistakes in leadership. So that's amazing. And I think that the other part that you're kind of weaving through that, it is the feedback provision and being we like to use the framework of radical candor, where there's two kind of axes. One is care personally, but then also challenge directly. And we always bring people to that. And the whole point of not having a discussion about someone who's not in the room and directing people to talk to them in person. So I love that. And that's so much a part of our ethos at Galaxy. But there's also other conflicts. So there's conflicts with clients. So I'll ask you this question as a curveball. Do you consider that the clients are always right for your team?
This episode is sponsored by Zomedica and their VetGuardian monitor. With VetGuardian, you can get continuous wire-free monitoring of vital signs like temperature, pulse, and respiration without the need for evasive leads or wearables. This means fewer stressful checks and a more comfortable experience for your patients. What's truly impressive is its zero-touch technology, capturing vital signs from up to 5 feet away. And through the VetGuardian Cloud app, you can monitor your patients remotely, getting real-time insights, live video feeds, and even thermal imaging with night vision for those overnight stays. VetGuardian is all about staying ahead. You'll receive instant alerts via text and email or audio notifications, and it makes managing patient records, reports, and videos a breeze. Whether you're at the clinic or at home, VetGuardian has you covered. Want to see it in action today? Schedule a demo at zomedica.com.
Ooh, that's a good question. I like it. Yes and no. How about that? So,
There's the answer you
yeah,
deserve.
that's what you get for asking that question. So, I do believe that the client is right in their own mind. I think that they believe what they perceive. And I think that's part of my teaching too with our client conflict, that it's important to listen to that, and it's important to empathize with it, but then also share your story. So I think that there are sometimes two sides of this coin, because while we can say, I'm sorry that you had that experience or that was your perspective, and let me share with you how my team was handling it. So I think that it's really, really important, especially with clients, to almost acknowledge that, you know what, you're right in your feeling. You're right in feeling that way. And I use and instead of but, and let me please share my perspective. Let me show you what I'm doing to mitigate this.
I think that's a wonderful answer, and it really makes me think of my next question even more, which is this alignment of communication styles. How do you teach that? And then I want to back into the question by saying, how did you find yourself with these skills and teaching them to other people?
Yeah, so I've done a lot of, I'm glad you guys brought up the radical candor. I love radical candor. I love dialogue preferences. I've done a lot of training throughout my career, leadership career specifically, but also when I was an associate doctor or even when I was a kennel assistant. And all of these trainings kind of really build on each other. And so, what my goal is, and this is kind of going back to what I was speaking about with like the leadership summit, just as an example, is I want to actually bring these dialogue preferences to our teams in a very structured way. Because I think if we all speak the same language, then we will be able to communicate better, for one, and then we'll be able to almost check and balance each other, kind of like what you guys were talking about, texting each other, hey, this didn't feel right, but you're speaking the same language because you were on the same page to begin with. So that's one thing. And then the second part of the question, I would have to say, kind of what I alluded to before, I've made many mistakes, lots of training for like specific things like the conflict, but a lot of mistakes, personal being, one example is when I was an associate doctor, I had a patient that I thought I did a really good job on. I thought I did great. And the client thought that the sutures were ugly and terrible and not nice things to say. And, I was, young in my career and actually young in my leadership journey. So I was basically developing into a kind of a chief officer of a hospital. And I tried to solve it myself. I tried to fight fire with fire. And the owner said, you and all of your doctors are incompetent, the whole hospital. And I was like, no, you didn't. And it just pushed a button and it blew up in my face real bad. And I actually had to have my direct line managers come and help me stop the fire because I was just too far gone. It was hitting home when if I had really backed up and thought about it, I wouldn't have reacted that way now. So I think that one of my things that I really focus on is losing the ego when you talk to clients, because a lot of times it's actually not even about us. It's not, doesn't have anything to do with our skills, doesn't have anything to do with, they don't know us from Adam's cat. They are expressing different emotions, being scared, frustrated. So again, it's more of that empathy. So long-winded example, but that's how you learn.
So, in that journey that you've been a leader of one hospital, how did transition happen that you evolved from an associate to medical director and now you're here, 70 hospitals? How did that happen to one professional?
Yeah, I don't know how it happened. I was well, actually, I can tell you what happened. I said yes. I said yes to every opportunity. So all my life, I've loved people. I love pets, of course, but I love the people that care for the pets too. And when I had different mentors who challenged me and said, you know what, why don't you try this out? And why don't you add this hospital? Why don't you add this hospital? And my experience got wider and wider and wider, and I was pushed. And again, I said yes. And so going from single unit to 2 to 3 pods of hospitals, I oversaw a dozen hospitals and then continued to grow. So I just keep saying yes.
That's some magical advice, I think, for people out there looking for challenges. Quick question for you. So we've got a wide audience. I'm sure we have some people that are really bad at conflict resolution in the audience and some people that are really good at it. What's some practical advice or resources that you direct people to if they're like, you know what, this is a muscle that I want to develop?
So I think the first kind of angle that I will answer it from would be a team-based conflict solution. So specifically something called a ways of working, or it's almost like a verbal contract. And it's really just laying out on the table, hey, these are the things I need to be able to work with you. And these are the things I need, like that I'll give you, that I will be happy to take on. And I think that if you're scared of conflict, I think if you go into a situation knowing that you're going to come out with an intended purpose or here's my goal, I think it helps a lot with just setting the groundwork, because you have to practice these things. It's not like you're going to be good at conflict management immediately. I, like I've said, made many mistakes, and I used to go to everything with fire, and now I come with water.
That's amazing. So, what's the big dream? You're 70 hospitals. Where are we going with VIP? Where we want to be in 5 years?
Yes, yes, yes. Continue to grow and grow and grow. I strongly believe in, just like in your name, the innovation piece is vital to our doctors and our hospitals and taking care of our pets. So the more that we can innovate our hospitals, whether that's AI tools, whether that's different systems that can be automated, I want to create a structure for our doctors that they can come to work and just be a doctor, be able to do the things they want to do, and always have that people first mentality. That's something that I'm very, very, very passionate about. And I believe that if we continue putting our people first, no matter what, then we will always come out on top, and we will always get, taking care of the pets, the needs, the productivity, whatever it is. It's our people that make the most out of everything. And I believe that if I continue with this vision and continue adding these tools that will help our doctors, then we will get there.
Dr. Emily, what a fun and interesting and inspiring conversation. We ran out of time. We always do this every single episode. I'd like to talk longer, have more questions, but I'll have to have you back. But before we wrap up, we've got a couple of quick questions for you. First is a book, YouTube video, something that's inspired you lately that you'd like to share with our audience.
Yeah. So really, I think that it was probably our mental health awareness recently that really inspired me to pull all of this information together to start talking more openly about the conflict management. So it's our own mental health focus.
Awesome. And the second question that we ask, is there another innovator in this industry that you would recommend to be a guest on this show?
I do. Dr. Aaliyah Harrison. So she is the CMO of Banfield Pet Hospital.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.